So we have covered the investigation to confirm the diagnosis of aplastic anemia. So now we have a short discussion of the complication and also the management of aplastic anemia. So the complication of aplastic anemia basically due to the problem that this patient has, which is pancytopenia. So the patient can have life-threatening hemorrhage, bleeding a lot because they don't have enough platelet. And patient develop alloimmunization for multiple transfusion because the patient need to be transfused very frequently, so they will develop alloimmunization. And then they have a tendency to transform to acute leukemia sometime later in the course of the disease. And sometimes the complication can caused by the treatment itself, because we will give the immunosuppressive treatment, we give immunosuppression drugs, so that they will have a secondary opportunistic infection due to the treatment. So these are part of the complication of aplastic anemia. So what are the principles of management? So there are two big we can divide it into two important principles. The first one is supportive management, in which we want to prevent and to treat the problem. So we need to treat or prevent the infection, we need to treat or prevent the bleeding, and we need to treat to prevent and prevent the anemia. So most of the time we need transfusion, so we need to give them packed red blood cells and probably erythropoietin to control the anemia. And we need to give them platelet transfusion because they have very low platelet, especially when their platelet is less than 10. So we need to give them platelet to prevent the bleeding. And also we need to give them the antibiotic or antifungal and some growth factor to prevent them to get the infection, because sometimes the infection can be very severe and can lead to death. And the other part of the management is a definitive management, so-called the curative management, in which they, because it's an immune problem, so the doctors will try to give him some immunotherapy, but at the end of the day, the curative therapy or the curative treatment of for aplastic anemia is stem cell transplant, because as we remember, in aplastic anemia, the stem cells are the problem. So we want to replace the stem cell with the new stem cells that are healthy. So these are the overview of the stem cell transplant, in which we will take a healthy donor that can donate their uh, stem cells, and then we collect, we process, and we preserve that, and then we prepare the patient by giving all the chemotherapy, and then we infuse the stem cells into the patient. So the summary is hypoplastic anemia is anemia due to inability of bone marrow to produce adequate RBC, and aplastic anemia can be divided into inherited and acquired, and it is characterized by cytopenias, hypoplastic bone marrows with no abnormal cells and no marrow fibrosis. Okay, thank you.